We have been involved with assisting in creation of the DoD VA osteoarthritis treatment guideline, which is focused on treating osteoarthritis specifically in active duty DoD personnel and in VA personnel. And we looked at this from a very specific perspective of the veteran and of the active duty DoD personnel, and have created a guideline to help primary care providers manage osteoarthritis, which we know has an increased incidence in this population. The guidelines help from the beginning with assistance with diagnosis, and then principally assistance with making choices about the appropriate therapies. Evidence-based assistance with choosing the form of physical therapy that's going to be best, choosing specific medications that will be indicated. These choices are all focused on patient-centered outcomes of function, pain relief, and avoidance of harm, and they're tailored specifically to the DoD and the VA. We got together a team of experts from the VA and the DoD and pooled all available research, looking to quality research, ended up pooling approximately 155 studies and taking the best evidence that's available out of those studies to make sure that we're treating osteoarthritis in the best way we can with the evidence we have. You should know that the guidelines emphasize some key areas, and that physical therapy and strengthening, particularly of the quadriceps and gluteus medius, are key to treating osteoarthritis pain in the knee. You should know that weight management is critical to the management of osteoarthritis, and beyond that, there are a variety of therapies that can be effective, whether it's oral NSAIDs, Tylenol, or injection therapies, all of which can be utilized prior to a surgical referral. And the guideline helps you step through those various treatment options with guidance that keeps you from hopefully harming the patient, and provides useful information at the point of care for the primary care provider. It could be of benefit to anybody that chooses to use it. We focused a bit on the military population as much as we could, although the vast majority of these studies are done in the civilian population. And so I would say that this guideline, like many of the VA DoD guidelines, are really very broadly applicable. Well, certainly, to my knowledge, every military rheumatologist, at least that I know, is a member of the American College of Rheumatology. Certainly we utilize the ACR guidelines to assist us in decision making when it comes to osteoarthritis, gout, and the other guidelines that the ACR has published. So yes, I would say that we are active in that organization in particular, and utilize their guidelines readily. I'd like to think that we have a special role to play because we know where these patients come from. In many cases, we've been where they come from, whether that's Iraq, Afghanistan, or wherever the military may choose to send us. And it makes a bond that helps us treat our patients.